My name is Paul Sims. I'm coming to you today from London, where I'm extremely pleased to be hosting today's webinar, The Coming AI and Data Revolution in Healthcare, How the European Health Data Space Will Revolutionize Evidence Generation in Life Sciences. I will, of course, be joined by some people far smarter than I am, and it's going to be an excellent session, I am sure. So when it comes to health economics, pricing, market access, these are critical and political issues all over the world, and there are brand new factors that are coming into the equations that we use. So many factors that, whilst many of the people listening to me on this call right now would describe themselves as experts, I bet that some of you even have begun to question whether all of your expertise is still relevant. But there are certainly new factors at play which nobody's experienced in. And of course, once again, AI is able to respond to those new factors without hindrance and give us a more certain future. So you've heard a lot from me. Let me just quickly introduce who I am going to share this session with. So first is Nick Schneider, who is the head of new technologies and data use at the German Federal Ministry of Health. And Nick is a leader. He's leading the division of new technologies and data. He actually has a very interesting past. He grew up in Latin America, studied medicine. He had several years of involvement in EU health politics, performed a postdoctoral fellowship in health policy research in California, and actually worked at the Unit for Cancer Prevention at the German Cancer Research Center. In 2011, he joined the German Federal Ministry of Health, where he coordinated the negotiations for the EU GDPR and its implementation into health law on a federal level. So obviously with the GDPR experience, Nick has been involved in data from a different perspective for quite some time. Now, as he's pursuing this role, I think we're going to hear some really exciting things about what is possible going forward. So thank you so much, Nick, for being here. Really fantastic that you can lay us a foundation today.
Thank you so much, Paul, and good afternoon, everyone. What I'm going to talk about is the creation of the European Health Data Space, which has been called a priority at the Council just over 2 months ago, October 2nd, and I do think it's been very timely. Next slide, please. So why do we need actually European Health Data Space? I'm going to look back a bit on the road which led us there and why it became, also from a personal experience, an important endeavor to create something like a data space on European level. Then I'm going to bring you a bit about our plans during the German presidency, how we try and are still working on building political momentum to get the data space on track, and what will come next year and the years thereafter. And I think that's something we still need a vision on how this European health data space has to be looking out and what could be part of it and how it has to be governed. I think the governance is going to be a key question. And then I'm going to talk a bit about the joint action and what codes of conduct could do. Next slide, please. So, as Paul rightly said, when I worked on the GDPR on European level, especially within Germany, which is very strongly regulated when it comes to data use and data protection, what we realized is that there is no real free flow of health data. We do have the GDPR, we do have sectorial laws, we do have national laws, and in some states like Germany, we even have laws on subnational level. This actually led to different legal layers. This led to a system where we do have a fairly harmonized GDPR regime in Europe, but when it comes to secondary use of health data, we have a regime which is far too complex for industry, but also for researchers. And this we have to solve in a certain way. That was the reason why 2 years ago, right before the COVID-19 crisis actually hit Europe, we already started talking to the Commission and some member states to bring this issue to the agenda and bring those communities, data protection community and the health community together to solve this issue and to solve this fragmentation. Earlier this year, we had 5 workshops with a number of member states, stakeholders, data protection authorities, industry representatives, researchers, EU institutions to see what could be done and actually how we could frame a European health data system which allows free flow of data and which actually ensures that we can, when it comes to data technology, also compete with other markets like China and the US, something which at the moment is fairly impossible due to different regulations within the Union. What we actually saw is that there's a lack of consensus within the member states on the scope for national derogations on basic definitions like when is data really anonymized? What is anonymization? When are we talking about primary or secondary use of data? This is language which is used by within the legal community differently than within the research community, and again different within the medical community, which is where I'm coming from. There are different legal bases being used. The rights of data subjects are being pursued in different ways, the different derogations in the member states. So even the semantics don't match up between one member state to the other. And of course, there are huge differences in data quality. Next slide. And to overcome all those issues, we need to sit together. And I think we need to, and that was something which, and Lupin already saw this slide, I think over a year ago when we met the first time in Brussels. What we actually needed was a strategic approach to the so-called European health data space. We all share the same vision that we want to have health for all. We want to have a healthy population in Europe. We also share the same principles. We do want trustworthy AI in Europe. We want to have a trustworthy system working in Europe, and we would need to have some kind of collaboration within the European sector. We want to have free flow of data between member states, and we want to see the union competitive, especially competitive on global scale. So if we have the same principles, we have the same vision, how can we achieve this? So what we actually, in the end, will need is a common regulatory framework for AI, especially in the health sector. We will also need joint, interoperable health data infrastructures. I'm not talking about one infrastructure. There are going to be several. And I'm going to see, in the end, I believe it's going to be a network of networks. But this network needs to be able to communicate. We need to be able to access data across the borders in the European Union. And what we also need, especially for those areas where data is still governed by consent or by contract, which is governed directly by the GDPR, we will need some sort of codes of conduct for health data use to come to a joint understanding, to overcome those differences on a sub-legal level. And those codes of conduct should be actually drafted by the actors, by the industry, by the researchers, by those involved, but heavily supported in their development by the member states and the European Commission. And they are there to actually give something which the GDPR in the health sector is not providing yet. And that's legal certainty and legal clarity. Next slide. So as I said earlier, what we did is actually we did a mapping on how the GDPR has been implemented in the health sector. This was done through the European Commission with strong support from the European Commission. The report is probably going to still be presented this year. It's been in draft at the moment. And it showed that actually there are a lot of things which could be done, starting with legal acts, which joint legislation to actually give legal clarity, but also we're just drafting a common understanding. So what we have to look at is going to be how do we use data across the world to provide health and healthcare? How can we use it for a public health purpose? And the COVID-19 crisis, in the end, showed very vividly how important it is to grant access to health data on a cross-border level. We all saw that the European Centers for Disease Control had extreme problems in getting access to national data. The same is valid for the European Medicines Agency. And we need to be looking at how we can ensure that this happens in a better way. Yesterday, I had a very, very nice discussion with colleagues working in university clinics to improve their models for bed planning, for planning how available intensive care unit beds are and normal ward beds are in order to plan if they can start or restart elective operations again, if they can have their operation theaters open or not for the next 1 or 2 weeks. And I think those are issues which we can discuss on micro level between hospitals to reach solidarity between the hospitals, but also between member states. And we saw that we are actually moving patients already in the COVID-19 crisis to be treated in different member states according to the availability of intensive care units. And with this spirit, I think a lot have changed in the last year when it comes to health data use. And I think we are in a very good position to now push the envelope and increase momentum for health data use on a European level. Next slide, please. So what we actually wanted to do in the last half year, and it was planned before COVID-19, but was heavily influenced by COVID-19, was to learn from the mapping study, but also to have a discussion on ministerial level to put the issue of health data use and health data protection on the political agenda. This happened in July at the informal meeting of the health ministers. We had a high-level conference on digital health, EU on the Move, in early November. Lubna was one of our keynote speakers, and I think it was a very, very good conference to show that the whole community actually is very committed to actually work towards a European shared data system, especially in the health and healthcare. We took those lessons we learned from the conference and from the discussions we had between member states on to the political debate on technical level. They are going to be an integral part of the draft council conclusions, which we are hopefully going to be publishing in the next 2 weeks, which are now in final procedure between the member states. But a third of those council conclusions on lessons learned in health on COVID-19 will actually be dealing about data use and digital health. And I think that's a major achievement of the whole community. We have been very active throughout the last 6-7 months in actually running conferences, writing policy papers, continue the debate on why important it is to share data on a European level. And of course, the preparatory work for joint action on European health data space, all with a key vision to really build political momentum for the upcoming years to have European health data space being created and implemented as soon as possible. Next slide. And now I think that's the most crucial slide, which many of you ask, wow, he's talking about European health data space. How does it look like? We actually envision it a bit like a house which we build on European grounds with a strong foundation in a legal instrument. There's going to be a legislative act on the European health data space being published next year by the Commission. We have the first Data Governance Act, which has been published on the 25th of November, which is a general regulation draft on data use, which is going to be the one laying the ground roots for the HDS. But there's going to be a sector-specific one coming next year. We're going to have a joint action with already 22 member states participating on the European health data space to draft ideas for a governance infrastructure for the European Commission. There's going to be funding from the EU4Health program and other programs for digital health in Europe. There's going to be a lot of engagement from actors to develop codes of conduct on secondary health data use. And as of next year, there's going to be a pilot project starting with a couple of member states to demonstrate the feasibility of cross-border access to health data. This one shall not only include a few member states, but also the European Medicines Agency and possibly even the European Centers for Disease Control. I think there's a lot to be done by the Commission and the member states for next year. The aim is to, by 2025, have a working interoperable data access infrastructure to facilitate secure cross-border analysis of health data. It's going to be, that's my personal view, a federated system. It's not going to be a central one, but one which will be working and where actually we all can get access to data in different rooms. That's why I say it's a house, a transparent house with big windows, but there's going to be a room for the patients. There's going to be a room for the doctors to access the health data they need. There's going to be a room for pharmaceutical industry for the data they need. And there's going to be a room for the patient. I think the biggest room is going to be the one for the patient to actually manage their own health data and also have sovereignty over their own health data. I think that's something which we need to be discussing around. And I think the house idea is actually with different rooms, something which we can work on. The French Health Data Hub has a similar view. And I think there's a lot of consensus building going on right now in Europe to develop this data space. Next slide. And now just to wrap up, joint action is going to be looking at 4 main pillars: governance, quality of data, an issue which has been addressed by you earlier in the little survey, infrastructure and capacity building for member states. It has a huge impact on the member states. I think it's quite rare for a joint action to have 22 member states participating. That's going to be a challenge, but I'm very confident that our friends from Finland, which are leading the joint action, are going to do their best and are going to bring everybody on board to have good outcomes in the next 2 years working in the joint action. We have to align it with other activities, the European Health Network, the eHealth Network, Gaia X, which is also building an infrastructure on technical level, and the codes of conduct will start in the first quarter of next year. So stay tuned. I'm quite sure that there's going to be a lot of work coming out of that group. Next slide. Just briefly, the codes of conduct. As I said, they need to be tailored for specific categories of data processors and specific situations. They have the foundation in the GDPR. They have to be accepted by the data protection authorities. That's why they get a certain weight and will lead to legal clarity and certainty. They can especially be used where actually the European Union doesn't have a competence to rule things, areas which are member state competence or situations which are usually governed by consent or by contract. Next slide. And the next, and I think that's for me as a member state representative, the most important point, we need to work and do better on cooperation between member states. We need to identify use cases where we exchange data. The Inform network in pediatric cancer has been a very good first example where so far over 1,500 young patients actually could have access to better treatment, where we could find a second pathway for them to get personalized medicine to treat recurrent pediatric cancer. And I think that's something which we can do better in publicizing as well. I think a big question we have is how to actually bring the relevance of health data use to a broader audience, how to ensure that the added value is seen. And I think especially in rare diseases, in cancer, we do have a huge chance in actually explaining to our citizens and our patients that European collaboration pays off, that a strong regulatory framework within the Union will be helpful for all of us. And I think with that, I would like to finish up. Next slide. My details are here in case you have further questions after this meeting, and I'm there for questions right now. Unfortunately, we need to leave, well, in 6 minutes, but hope to stay in contact with all of you later on.
Thank you, Nick. And I really appreciate you taking this time despite only having a limited amount of time overall. As I said to the audience at the beginning, now is your only chance to ask Nick these questions, although of course he's been kind enough to share his details, so take those down as well. I've got a couple of questions. By the way, today's session is being recorded, so if you want to watch this back or share it with colleagues, then you can do so. You don't need to ask me for that. But anyway, Nick, perhaps the inevitable question from David in terms of the industry. We've got majority industry audience on the line today. How do you see the role of the pharmaceutical industry in the data access and coordination issue? Are we players or just interested parties? And I know you have an opinion on that. And then Mana Parodi asks, are the national data permit authorities now more concretely involved with the European Health Data Space project? Above all secondary use of data by holding a second seat as suggested in one of the latest eHealth meetings. Excuse me. Do you want to go ahead? Excuse me, of answering those two?
Definitely. Well, I do think that the industry is a relevant player. And I do think that, as I said earlier, with the house model, there should be a room for industry as well. Industry is part of our healthcare sector. And industry needs health data. And the question is, what health data do you need? And what rules are going to be applicable for the use of those health data? And I think in a regulatory environment, I think that's something which could be done. And looking at especially technology, we will not be able to compete on a global level if we have AI systems trained on Indian, Chinese, or American data. In the end, we will need some kind of European data to have algorithms being trained on. We will not have the super silo somewhere in Brussels. So we need to grant federated access to different data holders. And I think the Data Governance Act lays the perfect foundation for that. We'll be looking at training data sets, testing data sets for European enterprises on large scale. And I think our minister at our conference said it rightly. Even countries like Germany might be too big to fail in the data game, but in the end, we are also too small to thrive. I think if we want to compete on global level, we will need to have a European approach, to have trustworthy AI made in Europe, but also made for Europe. And I think for that we will need to have the data trained and the data used to be European data. And it will only happen if we can actually manage to jointly access data. And that's also valid for the industry.
Thank you, Nick. Thank you. And I realize you do have to go now, so I'm just going to say thank you. Obviously, feel free to reach out to Nick if you have questions that you haven't had answered today. Wish you best of luck with this. It's obviously a vitally important, so good. I thought you were just building the foundation, but it turns out you've built the whole house as well. So thank you so much, Nick. That's really
just to add up on the question on the DPA, of course, the DPAs play a crucial role and we are in contact with them. And the European Data Protection Board at our conference said the right thing, is data protection authorities are not protecting data, they're protecting people. And I think that's a very important message he gave there. And I think we have to work with the DPAs on this. And also we have to train them, because often what they lack is understanding on how the healthcare industry and how healthcare in general works and why data is so relevant to us. And with that, I would like to finish and thank you so much for having me.